morning, Mr. My name is Judith Masi, family nurse practitioner student from the United States University. I'm here to perform your thorax lung exam today. Could you tell me your name and your date of birth?
Linda Tab, 3/29/50.
Okay. And also I have to get a consent to be able to video this conversation or this exam because it's for education purposes, and I'm going to put on YouTube under unlisted for my instructors to view. Could I get your consent to go ahead and do that?
Yes, go ahead.
Thank you. Yes. At this point, while I'm talking to Ms. Tab, I'm inspecting her, looking at her to see her chest wall, how she's, you don't have to do anything right now, how she's breathing, and if she has any nasal flares or any breathing through her purse lips or any deformations from her chest that I can see, her respiration rates or efforts. Are they rapid, deep, or just regular? I can say they're regular, she's breathing normal, she's not in distress. And then I'm gonna ask her to get up so I can observe the back as well. And the back also is symmetrical, same as the back of which posterior and the anterior part of the chest, they're both symmetrical. She's breathing normally. The scapulars are rising and they are equally, no deviations, no distress and no differences. They're both rising at the same time. Okay, you can sit down. And I can say that through the observation of anterior and posterior, the ratio is about 1:2. So both I observed the sitting and standing, and like I mentioned, I observed the scapula rising, the chest rising. They're both symmetry. The shape is normal. There's no deformities. And then at this time, I will go ahead and palpate. Using, I can either use my one hand or two hands, with my finger, with my finger pads, and to palpate for any tenderness or feel skin if it's warm. And also to check her fingers, make sure they're not clubbing. To check the shape before I palpate, I can check, make sure the skin color and everything is good, and then I can palpate and feel she's nice and warm. The skin color tone is equal. I can check her fingertips for clubbing. They're not clubbed. The shape is equal. It's about, I can maybe estimate about 160 degrees and no bigger than that. And when I push both the fingernails, they are able to blanch and be able to pink out within 3 seconds. So she's good on that. And also I can check, I can palpate on her chest, just for maybe any tendernesses, discomforts, or what's called costochondral tenderness in the rib joints. And if you feel anything, you can stop me. I don't feel anything. Begin from I can go over from the over the scapula, coming down to the midline, from the left to the right side, and I don't feel anything. I don't feel anything, no air pockets or anything like that. But she's not complaining also. And I'm preparing, bilateral also I'm feeding, and comparing both sides. They're symmetrical. And I can also check maybe the other side here. She don't feel good. She's not complaining. If you can pull up a little bit. And I can also palpate under here in all the lung fields. I don't feel anything. And the same thing I did up in front, I can repeat in the back. So I'm just gonna go ahead and do both sides so I don't forget. So I'm going to palpate starting from the surfaces of the scapulars, and and also again I'm palpating for any tenderness, any crepituses in the areas, maybe on the lung fields. And also I go in bilateral to palpate the middle lobe, the middle lobe. Yeah. And also as I am going through here, I don't feel anything, and no air pockets or any crepituses, and no pain or discomfort. And sorry, I didn't mean to push that one with you. Yeah. So then from there we're going to I did perfect the front here, and then from there I checked for crepituses, so I didn't feel no cracking sounds or any, subacute pockets like emphysema pockets. And then from there, I did check for the perimeters. I did. Oh no, I didn't check. So the next thing I'm going to do the perimeters, where I'm going to have her say a 99, and then I'm going to check with I can use either one hand or I can use both hands, and I can using the bone side where my ulnar finger is, and I can have her say 99,
99,
99,
99,
99,
99,
99.
99,
Okay, and I can do the same thing here. 99,
99,
99,
99,
99,
99.
and again, the voice of vibration is equal on the same side. I have to come all the way down here. 99,
99,
and then down here.
99,
99,
99.
99. So I don't feel anything abnormal. The vibration sound is equally normal. There's no deviation from either side, and I don't see, because normally if there's some consolidation in there will be probably like as the air moves through your bronchioles, if there's any problems, then the voice will not be, it will either be equal or the other side will be less, vibration will be less, but it's equal. There's no problems. And then at this time, I'm going to repeat on the back as well, the same thing. I'm going to do the same thing. So you go 99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
and again the voice is the same. There's no I don't feel anything abnormal. The voice is coming asymmetrically on both sides of the lower lobes. And I can go behind here, 99.
99.
Alright, so the voice response or vibration is equally the same, so I don't hear no deformity or any maybe they are not asymmetric or they are symmetric. And then I'm going to do what's called a chest excursion, but I can do it up front here and I can do it in the back. So what I'm going to do is, like, you can lift up, maybe press, hold her chest up here with my fingers almost pointing towards the xiphoid and in the costal margin of the chest line, and I'm going to ask you to take a deep breath. And take a deep breath. And as I'm doing this, I am looking to see how my thumb separates when she breathes back out. And I can do the same thing from the back. Bring the chair, that little chair right there. Instead of me going to the back so she can see what I'm doing. Sorry, get closer, this way. This way, so she can see your back. Yeah, at the same time, I can also do the same chest execution or respiratory execution, the same thing I did in the front. So I'm going to go maybe like around the 9th, 10th rib, and also hold her in the lateral part of the posterior chest, and then maybe leave a little bit of loose skin in the middle, and I'm going to ask her to deep breathe again and out. And hold it. Okay, down, out. So again, like as I'm doing this, I'm checking to see how much my fingers or my thumbs separates, and they're moving equally. It's not like one thumb is pushed further or the other. They're both moving at the same time, so they're symmetrical bilaterally. Okay, you can maybe turn around this way if you want. The headache. Oh.
Oh, get up.
No, you can stay right there. And then the next thing I'm going to do is to perform our percussions. Here, I think you can start. You can sit on the bed. No, I'm sorry, closer. You can sit right here. Close, I'm sorry. So I'm going to do percussions, and also I'm going to start can see in the camera. I'm going to start from the anterior part of the chest. Can you see me? Yeah, I'm going to start from the anterior part of the chest to do the percussion, and I'm going to start towards the epiphyses of the scapula. I mean, I'm going to start from the front. So in this case, I'm going to start around the clavicles and coming down, and I'm going to percuss across side by side, from starting from the right to left. So using with my dominant hand, middle finger, and percussing on my left hand middle finger. So I'm going to start from the right to left. This is your right, right? Okay. Yeah. So I'm going to go from up above here and percuss, and go up here, and then come down, and come again to the right, and then come down, and then come down, and then I'm going to maybe lift up a little bit, and then come down to the right, to the left, and then bilateral in the lateral middle lobe lung field, and I do the same thing here. So, and normally this exam, it should be taken without clothes, but we're not taking in clothes at this time. I'm just going to pretend that, what I'm saying is getting through it. Chest exam, usually it's better without clothes. So, and then while I did the front, I'm going to do the same thing in the back. I'm going to go to the epiphysis of the scapula and set the same percussing from the right or left, but coming in the lateral all the way down, like side to side. So, so I'm going to start up right here in the epiphysis of the scapula to the apex of the lungs. Okay, here you go. And then I come down, left again, right again, down, left again, like in a ladder fashion, until to the other way to there, and then I'm going to do the lateral lung field on both sides. And also, the percussion sound should be resonance. There's no downness unless say I percuss in the organ areas, but in this case I was following the intercostal spaces. And then the next thing I'm going to perform what's called the diaphragmatic execution. So this has to be done in the back. So where's my ruler? Okay. I don't know if you can move a little bit. Yeah. So she can see what I'm measuring. This. Oh, sorry. So I have my ruler here to measure the areas, and I'm going to do it on both sides of your lower chest, posterior lower chest. So again, I'm going to go. I'm going to like percuss from about maybe around the 7th rib coming down, and I'm going to percuss. Whenever I hear the sound change from resonance to downness, I have to mark the sound, and then I have to ask you to deep breathe and hold it while I do this. Okay. Now you have to inhale using your lips. Again, I'm going to start up to this where I'm pretending that I'm marking actually here. Here. Right? So I'm going to, okay, you can let it breathe out. So I'm going to measure the difference in the mark. Oh, Lord help us. Yeah. I'm going to measure, and that difference in those two numbers should be around maybe like between 5 to 7. Yeah. So let's conclude the chest execution. Okay. All right. You can sit now. Normally, I think I have a couple more things to do. And like I say, you repeat this. I did both sides. So, and then I'm going to listen using my stethoscope. I'm going to start from move the camera so she can see us. I'm going to listen with my stethoscope, starting from the anterior part of the chest and the posterior part of the chest. Again, I'm going to start listening up right up above, a little above the scapula, so I can feel the areas of the lung fields. And every time you feel the stethoscope, you can deep breathe it out. Again, I'm performing in the lateral fashion. I'm sorry. And then, okay. And then we come to the middle lobe here on the lateral side. And then, okay. Then I'm going to do the same thing on the back. Again, I'm going to go in above this is of the scapulas, and I'm going to do in the lateral fashion, starting from the right, move to the left. Take a deep breath, and then again, 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 again. Then we go to the lateral part of the lung field, and then okay. And also, while I'm listening to see if there's any bronchitis or crackling sounds, and wheezes. She's normal. I didn't hear any sounds, no adventurous sounds on the bronchial area. I didn't hear anything, so the lung sounds are normal in both bases of the either lower lobe of the lungs, the middle lower lobes. I didn't feel anything. So, and then I'm going to perform the specialty test, egophony. So I'm going to test, and I'll have you say and if the sound which means we may have some consolidations in there. So let's go to standing. Alright. You say yeah, I can hear it real clearly. So again, let me go over the chest. So I can hear the sound just directly the way she was saying, and it was normal. And thank you so much. Thank you, I appreciate it. Yeah, I think we're done.